Okay, it can be quite difficult if you can't get into your 90-90 position because of your hip internal rotation limitations. Then there's alternative means by which we can still work on capsular space and hip mobility in a flex position within the confines where you don't have to like use your lumbar spine as your hip per se. So we're going to use a pretty thick resistance band. The thickness is irrespective of really, it's dependent upon what you need based off your strength and your own overall hip stiffness. So this one's about 20 pounds of tension or so. And I'm going to tether it to some type of anchor point, just something sturdy. And then I'm going to wrap it around the foot, which is initially going to pull me into hip external rotation, but then I'm going to grasp and I'm going to come up and over top of the hip. So now the line of pull and the vector of pull is pulling me into this internally rotated position. Okay? This is advantageous for a couple reasons. One, we can start to do some PAIL rails here. So that is progressive angular isometric loading. So the first thing is you allow the band to stretch you up into that end range position, keeping my left buttock on the floor, because it's going to want to go like this. So keep yourself honest there. You're getting a pure rotation out of the hip. Then I'm going to go into my contractions. So after I've been here for a minute and a half, stretching, breathing into the tissue, allowing the band to pull me greater into greater hip internal rotation. Then I'm going to contract. It's going to be a yielding isometric. So I'm going to meet the resistance of the band, driving my foot against the band's resistance. 1 1,000, 2 1,000, 3 1,000, incrementally, gradually ramping up for over 30 seconds. After my contractions there, I'm then gonna go with the band, trying to spin on this axis. I'm gonna try and extend or rotate my hip further into that internal rotation, and this is gonna be as hard as I can. Again, for about 30 seconds, keep driving, keep doing it, keep working. You can feel all this tissue on the outside. You don't want to feel any pinching deep inside of the joint. You just want to feel a lot of muscular work. All right, and then to kind of solidify the new position that you've just achieved and earned, you're going to hang out there for just a moment, about 30 seconds or so. The nice thing about this is that I can go direct. If I need a break, I can, or I can offload the band, go into my external rotation, and then do some eccentric neural grooving where I'm slowly contracting against the resistance of the band throughout the range of motion, reinforcing that tensile load through the connective tissue. Again, I offload, I externally rotate, I plant the limb again, and then I fight there for a moment, slowly controlling it into the eccentric internal rotation, getting some length through the deep external rotators. Okay, this type of input can be done on a daily basis, depending on the intensity at which you do it. Frequency is going to be your friend. If you look at the pre and post, right, so then here's my hip internal rotation on the left, which is usually more limited than my right. And then if I look at my right, so my right hip also needs this input in order to be able to match this active hip internal rotation. The better your hip can rotate, the better it will function as a hip, and your other planes of motion will come along.